right, so welcome back everyone. So we are placing the focus now on World Glaucoma Week. With us this morning, we do have ophthalmologist and CEO of the Trinidad Eye Hospital, Dr. Ronnie Bhola. Dr. Bhola, good morning. Thank you for joining us.
Good morning, and thank you for having me on the program. It's a real pleasure.
Of course, Dr. Bhola, the pleasure is all mine, Dr. Bhola. Before we get into the World Glaucoma Week, let's talk a little bit about glaucoma in Trinidad and Tobago. How serious is the situation of glaucoma in Trinidad and Tobago, Dr. Bhola?
You know, at one time we thought this disease really wasn't that significant, but we've been looking at glaucoma through our diabetic screening program for the last 5 to 7 years. And what we've realized in the adult population, more than 1 in 10 patients that we look at in the adult population in Trinidad seems to be at risk of this problem. This is a serious problem.
Dr. Bhola, you have linked diabetes with glaucoma. Do they go hand in hand? Is it that persons can get glaucoma only from diabetes, or are there other contributing factors?
Yes. Although I link it there through our diabetic screening program, I think once it's really the adult population. Once you're over the age of 40, I would say you're at risk. The most at-risk group that we found is the Afro-Caribbean patient who, over the age of 40, who has a family history of the condition. So those are the 3 things I think is the most likely to be the risk factors to put you at a higher risk. Diabetes, I don't think is high on that list. I think those 3 would be the 3 that I would say you must get checked.
Yeah. And doctor, let's get deeper into the disease of glaucoma. What exactly is glaucoma?
Yeah, the glaucoma, the type we see here that needs to be highlighted is when the eye pressure goes up in the eye, and we think that pressure may be compressing or damaging the optic nerve in some way. And what that does is it starts to affect your peripheral vision. And then that peripheral vision keeps coming in and in. You keep losing it until you get something called tunnel vision, where you could just see in the central area. And that is considered blindness from glaucoma. And it is irreversible when it occurs.
Wow.
So picking it up at the early stages is very important. It is irreversible, rarely, but it is treatable. So if you catch it before it started affect the peripheral, the vision, then you really save the vision. So really screening is really a very, very important thing.
Yeah. Is that one of the main symptoms that your peripheral vision is going to be closing in more and more?
That's the bad thing about this glaucoma. It is asymptomatic. It doesn't have any symptoms. It's been labeled the silent thief of sight, and it really is a good label for it. And really, you wouldn't know what's going on in terms of your vision loss until it's too late, until you reach a stage where we can't really do much for you. You already have the tunnel vision by the time you come. So I would say, you know, it's one of the things that we should be looking for at all times. And really all ophthalmologists, optometrists, all the eye care professionals know this. As soon as you go into their practices, they measure in your eye pressure and you want to know why. Well, they're looking for this glaucoma because you may be at risk just because you're on this island and you are over the age of 40, you're an adult over the age of 40. And you know, sometimes you don't know you have a family history of this problem because you may not be aware.
Yeah. What would you suggest? Eye tests every year?
Well, every year, I think every 1 to 2 years is the standard thing that we do here. That's a good thing that we have in this country. Most people really, once they could manage it, would have their eyes tested either for glasses or something else every year or two. Two is usually the kind of upper limit to that. And I think that should be enough for you to, ensure that you don't have this condition. What they do as soon as you come in is they do the eye pressures, and they also look at the optic nerve. Because just by looking at the nerve, we could get an idea if you have, or if you're at risk of developing the disease, because we start seeing some changes on the optic nerve that alerts us we need to do a little more. We need to do a little more testing, or we may need to put you on some treatment to prevent a problem.
Dr. Bhola, can we get a little deeper into the treatment? What is the treatment like?
So in the treatment, what we're trying to do is reduce the eye pressure in some way. And the most common form of treatment is we use eye drops. And those drops either reduce the production of the fluid in the eye, or it increases the drainage of fluid out the eye. So these are the two mechanisms by which we reduce the eye pressure, by either reducing the amount of fluid the eye is producing or draining it a little faster. And drops is the most common way we do that. Luckily, over the last 5 to 10 years, we've been able to improve on the types and the amount of drops that we could use, different types, to really reduce the eye pressure better and better. Nowadays, we also have a laser called SLT, selective laser trabeculoplasty, which could be used to reduce the eye pressure. So you reduce the burden of having to use so many drops all the time. So those are the two mechanisms we tend to use in most cases.
So if someone, let me ask two questions. So is it in more severe cases, the laser is used and the effect is much more long-lasting than the drops?
Actually, the new laser we have is now being considered first line in the treatment of glaucoma, because unfortunately, the reality is 30% or more patients we put on drops have difficulty using these drops every single day. So the laser is really considered now first line in the treatment of glaucoma. It is not a strong treatment. It's a relatively, it's similar to drops. It works in a similar way and gives us a similar effect as drops would do. The later on you are in the disease, the more likely you are to need major surgery. Major surgery is something called a tracheolectomy, or a valve that we put, which is an artificial valve to regulate the eye pressure. And these valves are pressure sensitive. So in the early stages, we're using the laser now.
Yeah. But doctor, of course, all of this has a cost, right?
Of course, there's nothing without cost. But just to mention, as you mentioned, that because we were doing diabetic screening for such a long time, we actually decided, because we saw so much glaucoma out there, we decided to have a more comprehensive eye screening program developed, all free. So I know you have our numbers there.
Yes.
You can call us and get screened for free. We have mobile units that go out and do a lot of free screening, but we also have in-house free screening. And now this free screening is done not only for diabetics, but for anybody out there who wants their eyes checked, because we want to try and pick up the glaucoma as well. So you call us, come in and get your eyes tested.
Yes, and this is a program that is underway right now, Doctor.
Yes, in 2024, we launched a program called a comprehensive eye screening program, and we have it going from this year.
Yeah. Doctor, we have been speaking so much about glaucoma. I suspect people must be saying, well, we forget about World Glaucoma Week. So how is it being observed in Trinidad and Tobago, Dr. Bhola?
Yeah, World Glaucoma Week is really focused on us having these kind of discussions, yes, and highlighting this problem to the population so that people become more aware that they have this issue within the country, and there is a need for us to highlight it and tell people, hey, get your eyes looked at, get your eyes checked, get your eye pressures measured. So in this week, that's what the societies have been doing. The Ophthalmological Society of Trinidad and Tobago, the Society of the West Indies, and we've all been trying to work to highlight this. In our population, you know, we have a higher risk population for glaucoma than the rest of the world, and we need to make sure we take care of our people, make sure our people could see so that we could progress and really develop our country.
Yeah. Now, Doctor, have more and more people, you think, been embracing the message about glaucoma and other diseases of the eye and have been thinking about eye health? You see more and more people kind of embracing that message?
I think so. You know, we don't, nowadays, what I notice, the majority of cases that I see, I get them much earlier into the clinic to get tested and to get diagnosed and to get treated. So we have a lot more patients we treating that either maybe just at risk of developing the disease, at high risk, or maybe in the early stages. So I must say, I think we are much better at managing and picking up the cases than we used to be, you know, 10, 20 years ago. And I think that's one due to awareness, these sort of engagements that we have with media, our ability to reach the general population through all the platforms that is available now. And then the awareness of people that their sight is one of the senses that they want to protect at all costs. They come in and they get themselves looked at.
Yeah. Doctor, we just have a few seconds again. Anything else you'd like to tell us before you leave us this morning?
I would just like to say, you know, make sure you focus on your eyes. You love your eyes. Make sure you go and get your eyes tested. If those 2 years pass and you haven't seen your optometrist, your ophthalmologist, make sure you get them looked at or tested.
Dr. Bhola, it was a pleasure speaking with you this morning. Thank you very much for the information and also education, Doctor. Bye for now.
Thank you. Thanks for having me.
Okay.
Real pleasure.
Yes. All right. It's time for another break. We're coming back, everybody.